Pronunciation Pro.
Pronunciation Pro.
Hello and welcome to the Pronunciation Pro podcast. My name is Annie Rudin and I am here to help you learn how to speak English clearly and with incredible confidence. We are continuing our series right now called Speak English Like a Pro, and we're diving into different professions and the vocabulary and tips and tricks for each of these professions. We've done pharmacists, we've done accountants, we've done mental health professionals, and today we're going to dive into the area of nursing. In the Pronunciation Pro program, we have many students who are actively working on their pronunciation skills and who we meet with either for one-on-one lessons or group training. We have different packages for each. But we have a lot of nurses and people who are either going through nursing school, who have recently graduated, and those who have been in the nursing profession for a long time and are working to, speak English with more clarity. They know that in order to continue to grow in their profession, they need to have strong communication skills, which is the case for pretty much every industry. Unless you are, basically behind a computer and have no need for that spoken English, pretty much every profession, as you advance in it, your communication skills become more and more important. And especially in these helping professions where you're working directly with patients who need your help and need that assistance. So we are here today to help you build and grow in your vocabulary, in your pronunciation, in your fluency, and that intonation that you need to have to be the most effective that you can be. I just need to kind of give a shout out to our nurses out there and those who are in this helping professional in the medical field. What a beautiful gift that you're giving to the world to choose a profession that is such a helping profession. I admire it greatly. I think it takes, such a big heart and willingness to, it's such hard workers and those who just have such a heart for their patients. And you don't get into the nursing profession unless you have a really big heart and want to help and contribute in that way. So I just have a lot of respect for you. And so whether you're a nurse in this helping profession or you just want to learn more vocabulary in this field of nursing, I welcome you today, and let's get started in our learning together. Okay. Nurses, they play a critical role in patients' safety and their well-being. There is a lot of teamwork that has to happen between nurses and other medical professionals. It's a very collaborative environment where you are working with a lot of different people, and it tends to be a high-paced environment and a high-stress environment. And so pronunciation is going to matter a lot. And your confidence in your communication is going to matter even more. So we want you to feel that confidence when it comes to your spoken English. If you're shying away from speaking, or you are muffling your voice because you're not sure if you're pronouncing things correctly, that is going to cause a lot of problems and be quite an issue. So here are some of the challenges that nurses are faced with when it comes to communication. There's just communicating clearly with patients who are in pain or distress. Now, this is a difficult situation because the emotional toll is already very high. And here you are trying to communicate, and you don't want there to be barriers between you and the patient, especially if they're struggling a lot. You want to create that smooth connection and for them to feel that you are there to help. Nurses need to give really concise and accurate updates to doctors. You need to be very direct. You need to be firm. You need to be confident in the way that you're communicating with the doctors. And so we need to make sure that we're communicating confidently in those situations. You need to understand and be able to repeat or these medical terms very clearly. Medical terms can be very difficult to pronounce. And so we want to make sure that you're using that effectively and that doesn't derail or throw off people as you're communicating with them. Another challenge is that you're navigating a very fast-paced speaking situation with colleagues. There is kind of a time element in this setting, usually. And we want to make sure that you're able to keep up and that you're able to communicate in that quick way. Now, along these lines, you do need to recognize that you are where you are in your English, and there's no amount of, kind of beating yourself up that will help you grow faster. I think the best way to grow faster is to be kind to yourself, to say, I am where I am, and that's okay. Nothing has gone wrong here. And that you are willing to give yourself grace and say, this is where I am right now, but I'm going to continue to learn and grow every day. So if you're not as fast in your communication skills, or it takes you longer to find these words, or you're not pronouncing things as clearly as you need to, that's okay. You're here, you're doing the work, and you're working on improving. I'm always very impressed with our students who are in the Pronunciation Pro program, and they're taking those steps to develop their communication skills. They're really, it's not a matter of like putting ourselves down or being cruel to ourselves, saying you're not enough. That's not going to motivate you to do better. Maybe short term, but it's not a long-term solution. What is a long-term solution is saying, okay, this is where I am. This is the gap between where I am and where I want to be. And I'm going to start down this path, and I'm going to take steps consistently towards the result that I want. And as you do that, and if you get on a path that you feel confident in, such as joining Pronunciation Pro and doing either group or your private trainings, you'll feel confident that like, okay, I'm going to get there, and I just need to be consistent with it. All right, so let's talk about some vocabulary and phrases to practice in this setting as a nurse. So how about this one? Blood pressure. Blood pressure. So we want to make sure you get that D at the end of the word blood. I hear a lot of D's and T's dropped at the end of words. And so we want to make sure that we get that mouth position. Blood pressure. Blood pressure. Blood pressure. Blood pressure. 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 So we want that R to be nice and clear. Pull that R back. I hear a lot of blood pressure, where it's like dropped and reduced vowel, but we need to pull that back. Blood pressure. Blood pressure. Okay, I'm going to take your blood pressure. Vital signs. Vital signs. The biggest trick is getting that long I. Vital. That T becomes a D because it's surrounded by vowels. So vital. Vital. Signs. Signs. Again, that long I. Vital signs. So full pronunciation with those long I's. Injection. 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 Second syllable stress, we're going to really emphasize that vowel in the middle of the word. Injection. Okay, how about this one? Wound. Wound. Ooh, ooh. We need to bandage the wound. Wound. So rounded O, double O sound. Woo, woo, wound. And we got to get that N in there. A lot of times I'll hear that N dropped and it just sounds like wood, wood. Okay, we want it to be wound, wound. We got to get that N in there or it becomes a totally different word. Prescription, prescription, prescription or prescription, 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 prescription. Second syllable stress. Monitor, monitor. Drop that jaw and get that full ah. Monitor, monitor. And again, that T becomes a D because it's surrounded by vowels. And we want to get that full R pronunciation at the end with that R vowel. Monitor, monitor, monitor. First syllable stress, monitor. Allergic reaction. Strong R there. We want to get that full R in there. Allergic reaction. Reaction. Allergic reaction. I hope you're saying this out loud with me and not just in your head. In your head, it's like learning to play the piano by just thinking about playing the piano. It doesn't work. Okay? You have to be moving your mouth to get better at your pronunciation. How about this? Dosage. So we have that long O, dosage. First syllable stress, so that second syllable is going to be a reduced vowel pronunciation. Dosage. How about IV? I'm going to give you an IV. So these acronyms, where we're just doing the letters, really need to have that full pronunciation. I needs to be full. IV, V. A lot of times I'll hear B instead of V. So v with our teeth on the bottom lip. IV. If your lips come together, it's not going to sound like a V. It's going to sound like a B. So IV. Pulse. Okay, we have a dark L in here. Pull. Dark L's, the tongue does not touch the roof of your mouth. Okay, pull. It's more of like a cup sound in the middle of your mouth. Pulse. Oxygen. Oxygen. Okay. And I love that you're listening to this through podcast or video. And I'm purposely not putting the words in front of the screen because I want you to build that auditory connection. I want you to just be listening instead of relying on the written text. Oxygen. It's not how it's spelled, it's how it sounds. So let's really focus in on how these words sound. Because as you get better at the listening skills and you're matching those listening skills, you'll be able to hear words better and match them better in just your daily life. All right, so let's go into common phrases. So I'm going to say some common phrases common to nursing, and I want you to be practicing them out loud with me. And to get that fluency, we're going to talk about rhythm, we're going to talk about pronunciation, and make sure that you're getting this clearly. So on a scale of 1 to 10, how would you rate your pain? Okay, we're moving our mouth. We're slowing down. We're moving your mouth. We're getting louder. Okay, we want to make sure it's clear and easy to understand. We're also going to emphasize numbers. Okay, names, numbers, and negatives. We always stress those words. Okay, 3 N's. Names, numbers, negatives. So on a scale of 1, get that N at the end, 1 to 10. 1 to 10, okay, ending sounds are important. How would you rate your pain? Okay, long A's there. Rate, pain. How about let me explain the procedure? Let me explain, long A, Let me explain the procedure. Procedure, second syllable stress, procedure. The doctor will be with you shortly. The doctor will be with you shortly. Okay, when will the doctor be with you? Shortly. Okay, this is what we're communicating, the information that we're communicating. So we have the doctor, and they'll be with us shortly. So those are what we're going to emphasize in this sentence. The doctor will be with you shortly. So getting those phrases and just repeating them over and over and over again will help your mouth just fluently move through things. So if you're saying a phrase like this and your mouth has a hard time kind of connecting to the next word, or it kind of stumbles a little bit, that just tells you you need to repeat it like 5 times and get that smooth connection. Are you allergic to any medication? Are you allergic to any medications? Are you allergic? So that's key information, allergic. Are you allergic to any medications? Allergic medications. So if I only heard allergic and medications, I'd still be able to understand the context of it. If I only heard doctor shortly, I would understand the context. Okay? So it's those key words that I want you to really emphasize or stress. And when you're listening to others, that's what we're listening for, is those key words. Because even if we don't hear all of the little words in between, if we hear the stressed words, we are going to understand the gist, kind of the idea of what they're saying. Okay, we'll need to take your blood pressure again. We'll need to take your blood pressure again. So if I would say take blood pressure, you know exactly what I'm talking about. So those are the words that we want to stress and emphasize. We'll need to take your blood pressure again. We'll need to take. Okay, that's the process we want to do, is get fluent between these phrases. All right, so let's talk about kind of some areas of pronunciation that we really want to focus on when it comes to nursing. So you want to be very clear on numbers, okay? The dosage, the times, the room numbers. This becomes critical in nursing because that's life important information. If you get the wrong dosage, if you get the wrong time of dosage, if you get the wrong room number, okay? These are just very, very important. So clarity in your numbers. So I want you to really practice your numbers. Be really clear, big movement in the mouth, full pronunciation, full vowels, okay? Teens and tens are really important. When we're saying 13, we're going to emphasize teen. It's going to be second syllable stress. When you're saying 30 or 30, we're going to do first syllable stress, and it's going to be D at the end. So 30, 40, 50, 42, 42, 42, okay? Versus 14, 15, 16, 17. So there's a lot of emphasis on that teen because we want to be very clear that it's teen and not 10 or 4D, right? We need another area to focus is final consonants. Final consonants. We have to get those ending sounds on words. Dose, those. We have to get those ending sounds. So really focus on those ending sounds of words. Okay, how about the intonation for instructions versus reassurance? So he needs 20 milligrams of the IV. Okay, I have no idea if that's even a thing, but we need 20 milligrams of this IV. Okay, 20 milligrams of this IV. It's very strong. It's very direct. You're going to have downward intonation. If you go upward intonation, we need 20 milligrams of IV. It sounds like a question. You do not want to have that when you're giving instructions. You want to be clear. You want to be accurate. You want to have that downward intonation, and you want to still sound strong and authoritative, like you're the expert. Okay, we need 20 milligrams of this IV versus the intonation that we use when we're reassuring, our patients and their families. Patient will be out shortly. I really, he did a great job in the surgery. He's recovering now. There's a softness to it. And do you have any questions for me? Okay, how can I help you? There's a softness in that intonation when you're reassuring your patients, when you're really kind of trying to manage the emotions of it. Keep your tone really calm, a little bit softer. It doesn't need to be quiet, but it needs to be softer. So if you're saying like, do you have any questions? That's a stronger, more abrasive tone versus, do you have any questions? Do you have any questions for me? Do you have any questions for me? Okay, that is a calmer, more reassuring. So really practice that intonation, get awareness of your intonation. I had one student who was a nurse, and she was saying that, a lot of times she has an Asian background. Her native language is Chinese, and there's a little bit more of like an abrasiveness to the tone of for her native language. And so she has to really focus in on kind of creating that softness in her tone. So if that's kind of your challenge, if you have been given feedback that you sound a little bit, mean or harsh or kind of more assertive, then that's probably why. There just needs to be a little bit softer tone for you to kind of come off as more caring and compassionate. All right. Another pronunciation tip here is to focus on short and long vowel contrasts. So one that is very, very common is the short E and long I. Or sorry, short I, long E. So I versus E. So sick versus seek. Shit versus sheet. Okay, we want to make sure that that's very clear. So that short I, long E. And if you need more practice with that, obviously we can help you at Pronunciation Pro. You can look it up on ChatGPT and look at and just have ChatGPT give you one practice I like is, if you said, give me minimal pairs for the short I and long E words in American English. Okay, so minimal pairs is what that practice is called. Okay, so here are a few tips, a few more tips. Practice of how to practice, I guess. So practice giving shift reports out loud. Record yourself giving these shift reports. The more repetition that you have with it, the better. Use shadowing techniques. So repeating after native speakers in nursing videos, in certain situations, being able to repeat the way that they say things and doing that shadowing technique really helps. Learn 5 go-to calming phrases for patients and practice the tone. Being able to say, how can I help you? Or do you have any questions for me? Or you're going to be just fine. Some kind of practice go-to calming phrases that you can have for your patients. And, ask native speaking colleagues for feedback or correction. So opening yourself up to others and saying, hey, I'm really working on my pronunciation. People are willing to help, and they're not going to give you feedback unless you give them permission to. And even then, they might be a little hesitant. But if you could say, am I saying this correctly? They can give you a yes or no, but open it up, have others help you with that. I think it creates a lot of good connection, and it shows that you're teachable and that you're approachable. I think it's a really powerful connector, asking for help. All right, I'm going to go through a dialogue of kind of a nurse and a patient. So you're in a hospital room. The nurse walks in to check on the patient, and this is after a surgery. Okay, so the nurse says, "Good morning. I'm here to check your vital signs. How are you feeling today?" Okay, so upbeat, the tone is very upbeat and positive. So, "Good morning. I'm here to check your vital signs. How are you feeling today?" "Still some pain in my stomach. It's not terrible, but it's there." "Okay. On a scale from 1 to 10, how would you rate your pain? I'd say about a 6. Got it. I'll take note of that and let the doctor know. Just to confirm, are you allergic to any medications? No, none that I know of. Great. I'm going to take your blood pressure and temperature now. Let me know if you start to feel worse at any time. Okay, thanks for checking on me. Of course. I'll be back in a little while to see how you're doing. All right, so that's just a little example of something, a dialogue that you can use to practice. So try, recording yourself doing this dialogue. I'm going to include a worksheet for you in the description here of the podcast and the YouTube video so that you can practice that dialogue. Practice saying 5 medical terms clearly every day. Really kind of practice saying them out loud and deliberate practice where you're listening to yourself. And of course, you can join Pronunciation Pro. We have group trainings, we have private trainings and coaching. If your career is really contingent on your communication skills, get private training. It will pay off 100-fold as you go through your work, as you go through your career. Communication skills are not going away. It is something you're going to have to address at some point. And if it's something that you feel like is weak and needs help, then that's an area to really focus in on. I can't overemphasize that enough. I've seen too often our students, who have waited and waited and waited, and then finally get in and start doing the work to improve their communication skills, and then their career takes off. Then opportunities come their way, and I want that for you. So if you're ready to do the work, come join us at pronunciationpro.com. You can find the pronunciationpro.com app in the App Store, and you can kind of join that way or through our website. All right. Thank you for coming today. I hope that was helpful, and bless you, nurses and the healthcare professionals. We'll see you next time. Bye.
Pronunciation Pro.
Pronunciation Pro.